Hi, I'm Dr. Pamela D. Welcome to Answers. Since my movie Love, Sweat, and Tears came out on Netflix, so many of you have emailed me with questions, an unbelievable amount of topics. I couldn't really answer all of them individually, so what I decided to do was take the common parts of the questions and try to answer them on video. It's hard to individualize answers because I don't know your individual medical histories. For instance, do you have a uterus? Do you not have a uterus? Do you smoke? Do you not smoke? All these things factor into an answer, and that's why the best thing is to sit down with your physician and have a one-on-one conversation with he or she having your medical history in front of them. So let's get started. The first question that I want to answer is, should I take hormone replacement therapy or not? And my doctor doesn't feel comfortable giving hormone replacement therapy. This was an overwhelming first question for so many people. So I'd like to answer you how I answer my patients. Should I take hormone replacement therapy or not? Well, when you are sitting in front of me, my first question to you is, are you going to take the risks of hormone replacement therapy, or are you not going to take the risks? That is the first question. So, hormone replacement therapy, meaning estrogen alone if you do not have a uterus, and estrogen and progesterone if you do have a uterus, have some risks. The number one thing is that there is an increased risk of blood clots. We have known this for years. Blood clots that can form in your legs or pelvis or really anywhere and travel to other parts of your body. This is called an embolus or a thromboembolus. It can go to your lungs, causing a pulmonary embolus. It can go to your head, causing a stroke. It can go to your heart, causing a heart attack. Of course, all of these are very bad things that could happen to you and put you in the hospital and cause long-term problems. So if you are willing to take the risks because of your symptoms of hot flashes, that is first your decision. Estrogen replacement therapy or estrogen progesterone replacement therapy is not a drug that I tell you to take. It is a drug that you tell me you want, and after discussing the benefits and risks as it applies to your medical history, we will make a decision together. And that's where the doctor-patient relationship comes in. Now, if you are okay with taking hormone replacement therapy, I'm going to have one conversation. If you are not okay with the risks of breast cancer and blood clots and potential heart attack and stroke, then we have a whole different conversation. So let me back up a little bit more to the Women's Health Initiative, a study that came out initially in 2001, and then part 2 came out around 2004. And what it did was told us the risks of hormone replacement therapy in a certain subset of women. Now, overall, there was an 8 out of 10,000 more patients that had breast cancer over placebo, 7 per 10,000 increase in heart attacks, 18 per 10,000 increase in blood clots. So when you took a placebo versus estrogen, for every 10,000 women, 8 more got breast cancer, 7 more had a heart attack, 18 more had blood clots that may or may not have traveled to other parts of their body. On a positive note, around 22 people had less fractures. We have always known that estrogen prevents bone loss. But there's a definite association, although small, of breast cancer, blood clots, heart attack, pulmonary embolus, and stroke, which has to do with the blood clots. Now, If you have come to me and asked me for estrogen, you're obviously having a tough time. Menopause is not for sissies. Menopause is tough. I have a whole practice based on the 25% of people who are having a difficult time with menopause, hot flashes, mood swings, and we'll get to all those other things in subsequent shows. But for right now, I'm just going to focus on, should you take hormone replacement therapy or not? Now, once you've made the decision that, yes, I have got to take hormone replacement therapy, I would like to talk to you about the risks versus benefit of drugs. It has been well known for a long period of time that statin drugs, which lower your cholesterol, are so beneficial to you. If you take statin drugs, it's been studied over and over and over again that the benefits are amazing to decrease heart attack and stroke. The problem is there are risks associated with those drugs. Your liver can fail and you can die. If your liver fails, you're probably not going to make it. So whenever we put you on a statin drug, because of the risk of liver failure, we make you come in every 3 months or 6 months to get lab work and check your liver function tests and watch your cholesterol. As long as your liver function remains good, you can continue on the statin, and the benefits almost always outweigh the risks. Now let's switch to estrogen. What are the medical benefits of estrogen? Well, that's the problem. There's not really considered to be a medical benefit to taking estrogen. Now, I agree that there is a benefit to you feeling better and not wanting to kill people and not wanting to strangle your husband and not break out in a sweat when you're giving a presentation at work. Those are benefits, but largely they have nothing to do with your future life and prolonging your life. They actually could shorten your life. So on a true, pure medical indication benefit line, there's really no medical benefit. The risks are low. 8 per 10,000 women over placebo get breast cancer. 18 per 10,000 women will have a blood clot. I feel very badly for those 8 women, those 22 women, anyone who has a heart attack or stroke or pulmonary embolus. But the risks are very low. But when the risks are higher than the benefit, and there's really no benefit arm, it doesn't matter how low the risks are. The risks outweigh the benefit. Once we get to this point in our discussion, and my patient has decided to take hormone replacement therapy with either estrogen if she has a uterus, or estrogen and progesterone if she, estrogen if she doesn't have a uterus, and estrogen progesterone if she does have a uterus, then we're going to go over her medical history and see how it applies. So, what are the absolute contraindications, meaning you should not take estrogen replacement therapy? Number 1, undiagnosed genital bleeding. So if you have been menopausal and not had a period before for, say, 8 months, and all of a sudden you start bleeding terribly or spotting all the time, or it comes and goes, nobody is going to start you on hormone replacement therapy without finding out if there's something bad there first, meaning cancer. We have to make sure you don't have an endometrial cancer first. Second, known or suspected breast cancer. Your doctor is going to make sure that you have an up-to-date mammogram. Known or suspected estrogen-dependent cancer of anything else, such as endometrial cancer, breast cancer. That's really all I can think of right now. Active DVT blood clots. So if you have a blood clot somewhere in your body already, you're not going to get estrogen. Active history of stroke or heart attack. If you've had a stroke or heart attack, it's just not a good idea to take estrogen, because you would be taking another drug that would increase your risk of having another one. Liver dysfunction or disease, especially if you're taking the estrogen orally, because it can affect your liver. Known or suspected pregnancy, which doesn't have too much indication when I'm dealing with menopausal women, or if you're allergic to any of the components of the estrogen or progesterone. So one of the questions I got, one of my very first questions actually, was a woman contacted me and said, I smoke, and my doctor said I could not take hormone replacement therapy, and she's having terrible hot flashes. Well, we all know that smoking is not good for you, and we know that smoking increases your risk of other cancers. It increases your risk of heart disease, and it increases your risk of stroke. Smoking itself is not a contraindication to taking estrogen. If you, after knowing the risks versus the benefits of hormone replacement therapy, and you're miserable enough with your hot flashes that you want to take hormone replacement therapy and you smoke, you have to understand that you are adding to your risk. Now, what does smoking do? It increases your risk of cancers, heart disease, and blood clots. And then you add a estrogen that can increase your risk of breast cancer and blood clots. So it's more of an additive effect. Now, what are the risk factors for breast cancer? If you've already had breast cancer or uterine cancer, that's not somebody that we want to put on hormones. If you have a strong family history, say you have your mother and your sister and your grandmother all had breast cancer, well, we're going to take a step back and do some more evaluation. If a male in your family has had breast cancer, we're really going to step back and reevaluate your risks. If you had your period prior to age 12, or if you continued having a period after age 55, it adds a little risk of breast cancer. If you haven't had a child, or you had your first child after 30, if you've gained more than 45 pounds after menopause, if you drink more than 2 alcoholic beverages per day, if you exercise less than 4 hours per week, you have low levels of vitamin D, you have previous exposure as a child or young adult to radiation therapy of your chest wall, or if you've used hormone replacement therapy for over 5 years. So all of these are independent risk factors. Some are more weighty than others. Obviously, having breast cancer is much more weighty than having low levels of vitamin D. So smoking, which actually, interestingly, isn't even listed on this list from the North American Menopause Society Menopause Guidebook, is an independent risk factor for cancer. Cancer is a disease of age. The older you are, the higher your risk. So if a patient comes to me and is smoking, and say is in her late 50s or early 60s and is miserable from hormone replacement, miserable from hot flashes, and would like hormone replacement therapy, it's not an absolute contraindication. If you are willing to take the risks, and I have talked to you about what the risks are, and together with that doctor-patient relationship, we decide to try you on hormone replacement therapy to see if your quality of life is improved, then that's okay. And that's where the doctor-patient relationship is, and where it comes in so importantly. I don't have a relationship with you, but the patient in front of me I do. And she knows how I feel about her risks when I talk to her and individualize the therapy. You have to look at it from the doctor's perspective as well. I don't want to give my patient a drug that could hurt her. I treat my patients like my family. I'm the gatekeeper to give you a drug that could potentially harm you, cause a blood clot, a pulmonary embolus, a stroke, a heart attack, even breast cancer. Although the risks are very low, they are there. It would be easier for me to just say, I'm not giving it to you if you smoke, or I'm not giving it to you if your mother had breast cancer. That makes it easy for me. It really does. I'm not going to put myself at risk to give you a drug that can hurt you. Now, many of you may think I'm thinking about getting sued and a medical legal risk only. You know, I personally practice medicine as best I can, using evidence in clinical studies, which we call evidence-based medicine. I'm going to do my very best to give you the best information. And that's all I can do as a physician. But I, as a human being, as a person, I don't want anything to happen to you because of a drug that I personally gave you. So that's why we have to come to the decision together. So if you want hormone replacement therapy and you're miserable and your quality of life is horrible and you want to try hormone replacement therapy and you're willing to accept the risks and understand that the risks actually outweigh the benefits, because there's really not a medical benefit except that you feel better, then try it. There's nothing that stops you from trying it for just a month or two and see how it improves your quality of life. What if you're tremendously better? What if it changes your life and you're happy and you can work and you don't have mood swings and your family is happier and your husband is happier and you're happier and you like yourself more? Well, that may be all you need. If you don't feel that great on it, it's not made that much of a difference, well, maybe there's other things going on. And that's where the doctor-patient relationship comes in. That's where communication between the patient and the physician comes in. There's no right answer in taking hormone replacement therapy. What I do want you to know is that we want you, we being physicians, your healthcare providers, we want you on the lowest dose that takes care of your symptoms for the shortest amount of time. One of the risk factors we talked about earlier was that if you've been on hormone replacement therapy for over 5 years, it increases your risk. If you can just stay on hormone replacement therapy for 5 years or less and then get off of it and do much better, nobody will be happier than your healthcare provider. We want you on the lowest dose that controls your symptoms for the shortest period of time. If you decide to stay on hormone replacement therapy after 5 years, after you've discussed this with your physician or healthcare provider, that is completely up to you. I have women who have been on hormone replacement therapy for 20 years. They're happy, they try to stop and they can't, and their hot flashes come back just as badly, and they want their quality of life. That's fine, but we come to that decision together as a physician and a patient together. I sure hope this has answered your question about whether to take hormone replacement therapy or not. And if you smoke, you're adding a little bit of risk. Is it an absolute contraindication? No. You can always try and see how you do. Quality of life means a lot. This is Dr. Pamela D. with your answers to questions.